In this video, we will talk about estrogens. Estradiol is a sex hormone produced by the female sexual organs, that is, by the ovaries. Estradiol is an estrogen but not the only one. The three most important estrogens are estradiol, estriol, and estrone. Estradiol or E2 is the most important and best-known estrogen and is produced by the ovaries during the fertile phase of life of women, that is, from adolescence to menopause. The production of estradiol has the particularity that it is not produced continuously during the fertile life, but rather it fluctuates during each menstrual cycle. Estriol or E3 production is induced by the placenta and fetus during pregnancy. And finally, the production of estrone or E1 is induced by the liver and fat after the menopause. The prevalence of MS is higher in women than in men throughout the reproductive years of women, but not if the disease begins in childhood or after the age of 50, that is, after menopause in women. The main difference in women between fertile life and childhood or menopause is the production of estradiol, which is much lower before or after childbearing age. It is believed that estradiol concentrations during the fertile phase of life, which are around 200 picograms per milliliter, could facilitate the development of MS by influencing the immune system and intestinal microbiota. These estradiol concentrations could favor pro-inflammatory immune responses and consequently have a pathogenic role by increasing the risk of developing multiple sclerosis. These estradiol concentrations also seem to influence the intestinal microbiota. The composition of the intestinal microbiota in women during fertility is quite different from the microbiota in men or women over 50 years of age from the same geographical area, which on the other hand are quite similar to each other, suggesting that estradiol could influence the microbiota. For example, favoring the development of bacteria that facilitate the activation of pro-inflammatory cells. The relapses in women affected by MS are also more frequent during fertile life than during childhood and menopause, with the exception of pregnancy. During pregnancy, there is production of estriol, and in addition, much higher amounts of estradiol of around 14,000 picograms per milliliter are produced. These levels are much higher than those outside of pregnancy. This combination of hormones is believed to once again influence the immune system and intestinal microbiota with opposite results to those of estradiol produced when the woman is not pregnant. In particular, it is believed that this combination of hormones could promote anti-inflammatory responses that would have the purpose of preventing rejection of the fetus, but could also contribute to reducing the number of relapses during pregnancy. Estradiol could therefore have completely opposite effects on the immune system depending on its concentration. The combination of estrogens during pregnancy also seems to have an important effect on the intestinal microbiota. By facilitating the growth of bacteria that favor the development of relevant regulatory cells so that rejection of the fetus does not occur. Regarding disease progression, it only increases in women when disease starts in women after menopause. The hormone that is only produced in women after menopause is estrone, so this hormone could be related to increased disease progression. However, the progression of MS is similar in men and women when the disease begins in women after menopause. Since men do not produce estrone, it is difficult to directly associate this hormone with progression. The protection with respect to the number of relapses in pregnant women is undoubtedly very interesting. It suggests that the increase in estrogens produced in this period could be exploited as a therapy in persons affected by multiple sclerosis. These estrogens can be administered exogenously, and in fact, there are clinical trials that suggest that the administration of estrogens, and especially estriol, may be beneficial. Diet is also very interesting in this context, as some foods contain substances that can act like estrogens. Some plant-based foods contain active chemical compounds called phytoestrogens that can bind to and activate estrogen receptors, so they may have similar functions as estrogens. Normally, these compounds are found in very small amounts in food. Some of these compounds are isoflavones present in soy and derived products and legumes. Prenylflavonoids present in hops and beer. Coumestans present, for example, in alfalfa sprouts and clover, peas, beans, and broad beans. And lignans present in flax seeds, sesame seeds, whole grains, fruit and vegetables, and legumes. Normally, these substances are associated with a beneficial effect, for example, in the regulation of cholesterol or in the maintenance of bone density in the menopause. However, excessive consumption of foods that contain phytoestrogens could be harmful. One of the most consumed food that contains phytoestrogens are soybeans. Soy, like the rest of phytoestrogens, is considered a healthy food because it does not contain cholesterol, does not contain lactose, contains fiber, and contains unsaturated fatty acids. However, excessive soy consumption can be harmful in certain women. For example, if you drink only soy milk, if you consume tofu as the main source of protein, if you consume high amounts of tempeh or processed food that normally contains soy, the result may be an excess of phytoestrogens capable of stimulating estrogen receptors, which may be negative in women at risk of breast tumors. Excessively healthy foods can stop being healthy. The possible use of estradiol and estriol or phytoestrogens to treat MS is still being investigated, and we hope that in the coming years we will have clearer data on how we can use them to benefit people affected with MS.